And now I
Mhm.
am going to turn over the time to Marisa McPeck-Stringham, who is a licensed social worker and therapist in Utah. Marissa, can you hear me?
I can hear you. Can you hear
Perfect.
me? Okay. My
Yes.
video won't start. Okay, there's my video. All right.
Alrighty, let me know if you're able to share your screen.
Okay. I do this in telehealth all the time, so hopefully I can do it in Zoom. Um, there it is. Okay. Can everybody see that?
Yes.
Okay. All right, there we go. Rachel, did you want me to just introduce myself or what were
Yes,
you?
could you give us a little bit about who you are and then go right into it? That'd be
Okay. So my name, like Rachel said, is Marissa McPeck-Stringham. I am a licensed clinical social worker. I've been licensed for almost 5 years. I started as a therapist in 2020, so I should be used to doing some Zoom, some virtual, since I learned how to be a therapist on virtual, as you remember, 2020. Um, Before that, I worked at the National Center on Shaken Baby Syndrome for 6 years in Rachel's position. She's in now as information and research specialist. And that was a baptism by fire into a different kind of social work than I had ever practiced before. I got to do everything the macro level of education, the micro level, working with individual families. It really prepared me to be a therapist. And before that, I worked as an adoption caseworker. So I've been a social worker since 2007 when I got my bachelor's degree. Um, so after I left the National Center, sadly, that was a very hard decision to become a therapist. I also worked as a hospital social worker during the pandemic, which was a lot. And I also worked as a therapist part-time at our local domestic violence and sexual assault survivor uh, center. So I have a lot of experience with secondary trauma myself as a professional. And so I was happy to talk about this topic. And this topic is going to be, how do we support secondary survivors of shaken baby syndrome, and specifically about our these siblings of these children, whether the child was a victim and died of shaken baby syndrome. I'm sure Emily's children, Emily gave a great presentation earlier. I'm sure Emily's children, even though they never knew Elijah, they are still secondary victims because their brother was a victim of a crime, a horrible crime. And they're deprived of ever knowing their brother. Um, Another secondary survivor is a sibling of a child that became disabled because of shaken baby syndrome. And they might have very high needs, like some of the survivors that I've met. Some of them have total needs. Some of them are maybe not total needs, but still have needs. And then um, and just lots of uh, trauma that these siblings go through. And so I think this is a great topic because a lot of times the child who has been shaken and maybe become disabled gets a lot of attention from parents. And so often siblings feel left behind. So I can go on with my slides. I did that, you know me now. Okay, so what is secondary trauma? Um, we can refer to trauma as stress as well. If you know anything about family systems therapy, they talk about big T trauma and little t trauma. So sometimes little t trauma is just stress, high stress, right? So a stress response that can occur when an individual hears about, witnesses, or is otherwise indirectly exposed to a traumatic experience of another person. So a stress response, fight or flight, freeze or fawn, these are some more common stress responses, but everyone in this Zoom, I can say that they have been a witness or heard or been exposed to a traumatic event from another. If there's parents in this Zoom and your child is a victim or survivor of shaken baby syndrome, you're also a victim of secondary trauma. A lot of times when we talk about secondary trauma, we're talking about people like in my field as first responders, doctors, EMTs, firefighters. When I was hospital social work, I was in the ER a lot, and that was a lot. So secondary trauma doesn't just happen to children. It happens to all of us that are witnesses or exposed to a traumatic event. We're not the primary victim. The primary victim is the person who had the traumatic incident happen to them. And when I talk about trauma, I think trauma is misunderstood a lot. So I always tell my clients that trauma is a normal reaction to an abnormal event, right? The abnormal event is that somebody would shake a baby, most commonly because they're crying. That's the abnormal event. So your trauma response is normal, because if you were okay with a baby being shaken, I would worry about you. That's not a normal response to an abnormal event. So there are a lot of effects of secondary trauma. So in the short term, you might find this with your children, irritability. That's a big, big sign of anxiety, sometimes depression. And it's the little things that will just irritate these kids. Emotional numbness. They might feel nothing. I've worked with some grieving children who, when I'm asking them about how do you feel about your sibling dying. I have a current client whose sibling died. Or how did you feel when you witnessed your father abuse your mother? Sometimes they don't feel nothing. They feel nothing. And numbness is a sign that something is wrong. Stress, we talked about, and difficulty concentrating. If you've ever been in a situation where you're highly stressed, it's very difficult to get your brain out of that highly anxious situation and get it to calm down. Now, I have difficult concentrating all the time because I have ADHD, but that's neither here nor there. So some long-term effects of secondary trauma in children could be chronic anxiety. We saw this a lot during the pandemic, that these young kiddos were experiencing anxiety at levels that children don't ever experience before. And that is because their world changed so completely. And that's what happens when your sibling has been a victim of a crime. Depression, burnout, and other health problems. So here are some common mental and emotional symptoms of secondary trauma. And if I'm going too fast, let me know. And I don't mind responding to questions in the chat during this. I kind of like a conversation. So please don't wait to the end if you have a question. I'm more than happy to answer that. So these are some mental and emotional symptoms of secondary trauma. A big one is intrusive thoughts or memories of the trauma. Intrusive thoughts are just not thoughts that you don't want. An intrusive thought is like being afraid that something might happen that causes you distress. That could be, a parent with a new baby. I know I had some postpartum anxiety. I'm a mother of 4, where I would just always have an intrusive thought that I was going to drop the baby or something like that. That's an intrusive thought. It's an unwanted thought about a trauma. Sometimes memories can come back to a child who maybe witnessed their sibling being shaken. If any of you have seen the great documentary that was done, I think it premiered at the Philadelphia conference in 2022 about Josh Sorrells, I think it's called Like, Comment, Subscribe. I think it's longer than that. But if you ever saw it, his brother, Carl, talks about in the documentary, he was 5 years old and witnessed their mother's boyfriend shaking Josh. And I'm sure he didn't talk about it a lot in the documentary, but I'm sure as a 5, 6, 7, 8-year-old, he would have memories of that very traumatic event. Nightmares are a very common symptom of trauma. That's kind of one thing as a clinician that I assess is your child having nightmares? How often are the nightmares? Are these a nightly thing? Are they waking up with a pounding heart? Are they sweating? Those kind of things. Their nightmares can be very scary, and not just about the event that happened, but all the psychological sludge we have in the back of our brains there. They might experience increased levels of fear, or maybe sometimes even panic. I don't want to go to that place, Mom. It scares me. I'm panicked because something about that might remind them of what happened to their sibling. We talked about irritability. Another one is angry outbursts. We see this a lot with kids who have experienced any type of trauma. Kids don't have the emotional language to discuss what's happened to them or happened to their siblings. So a lot of times it comes out as like temper tantrums, or maybe yelling, hitting a parent, something like that. So one of the things I do when I'm working with kids is I really try to link in to their emotions, helping them identify their emotions. I'm in my office and I have a pillow that has a feelings wheel on it. Maybe I'll grab it so you can see it. Hopefully you can see it. But it's just a wheel, and it identifies some core emotions in the middle: happy, sad, angry, if you've seen Inside Out, those 5 core emotions. And it kind of branches out from there and helps them determine maybe they're feeling angry, but maybe that's not everything they're feeling. So they can look through and see, okay, I'm feeling, you know, hurt and scared and maybe sometimes numb. So this might be a good thing if your child is having a difficult time and having angry outbursts to get is a feelings wheel. And I got this pillow on Amazon, and I swear like all of my clients love it. They hug it during session, and I don't know if this is backwards in your screen, but it says your feelings are valid. And another thing I do with kids, and parents can do this too, it doesn't take a therapist to ask if kids are having trouble identifying what their emotions are. Ask them, where are you feeling this in your body? Are you feeling, for me, when I'm anxious, my heart is racing. I might feel sick to my stomach. Just identifying, okay, where are you feeling this in your body? And it might help you identify what is going on with your kiddo if they're having these angry outbursts. Others could be feelings of helplessness or hopelessness. They might feel overwhelmed and become overwhelmed by daily things that they did that they wouldn't have been overwhelmed by before. Getting out the door, getting ready for school, brushing their teeth at night, going to bed. Just those little things might overwhelm them. Again, difficulty concentrating. This might show up in the school setting. You might hear from their teacher that they're distracted, that they aren't concentrating in class. And a lot of times, and a lot of people don't realize this, that symptoms of PTSD and ADHD are very close to each other. So if your child has a sibling that has been abused, they might have difficulty concentrating at school, and they might get they might be diagnosed with something that they don't actually have. Memory issues is a really common thing with PTSD. A lot of times our brain will protect us from the trauma we experienced. So sometimes people come to me as adults and say, I don't remember anything from my childhood. And that's a big clue to me that there might be some trauma we need to unpack. Social withdrawal. This is a big one for kids who have experienced a trauma. They might not want to go over to their best friends anymore. They might not want to go to their after school program. They're staying inside. They're not going outside playing with their friends. Teenagers, if this is happening to them, might just, want to stay inside and play video games. I don't think that's uncommon with teenagers, but this might be a child who was used to be social. They might not want to play on their sports team anymore, or they might stop their music lessons. They might not want to go to dance. So this is a big sign. If your child previously enjoyed activities of a social nature and all of a sudden they are withdrawing into themselves, that might be a good thing to watch out for. Changes in their sleep pattern. And this is common with depression. I'm sorry, I need to drink a lot. I'm talking too much. I'm used to just listening to people, not talking. So changes in sleep pattern. That can be sleeping too much or sleeping more than they did before, or not sleeping as much as they did before, having trouble going to sleep, having insomnia. They can fall asleep, but they wake up several times. So any changes in their normal sleep patterns is something to look out for. Changes in the appetite. Now, with anxiety, people tend to lose their appetite. We have serotonin in our brains and serotonin in our gut, and those things are connected. So for me, when I have anxiety, I lose my appetite. Some people that might be, now I'm going to the potato chips. So just kind of look out for that. Is your child eating more than they used to? Or are they eating less? They might avoid situations or experience that might remind them of the trauma. They don't want you to drive past that house. Maybe the babysitter shook the child. They don't want to go into that neighborhood. Anything that might remind them of what happened to their sibling. They might have increased vigilance. That's a huge sign of trauma. Constantly watching out for who's here or checking the room, making sure they know the emotions of everyone, especially if you say one of their parents was the perpetrator or a step parent. They might be very good about reading the temperature of a room, just kind of know what everybody's emotions are so they can protect themselves. There's also some physical symptoms of trauma that we don't often talk about, and that is trauma can actually hurt. It can cause muscle pain. It can make you incredibly fatigued. Your brain's doing a lot of work trying to process that trauma, so it can be very tiring. And other things are headaches and stomach pains. That kind of same thing with, your brain and your stomach are linked because of the serotonin. So, kind of going back, what does the science say? So I did a lot of research. Once Rachel and Danielle asked me to do this presentation, just trying not to just go on my own anecdotal evidence as a therapist and things that I've seen. And one thing that I have learned is there is many studies that have shown that there's a strong evidence of siblings of children who have a disability, and a lot of our shaken baby survivors do have some profound disabilities. They are at higher odds of developing depression or other mental health difficulties compared to children of siblings who don't have disabilities. And this exists across all income levels. It doesn't matter if you are a very wealthy family with a disabled child, middle class, working class, lower economic sociostatus. This is something that can put your child at risk for later mental health difficulties. So what the research says is they are suggesting that these children are a vulnerable group, and that this vulnerable group is in needs of programs and services to help support their mental health. So there's a lot of protective factors. We kind of talk about risks. This puts your child at risk, but there's also a lot of protective factors. So allow me in the next few slides to fangirl all over Dr. Bruce Perry. If you haven't read any of his books, go to the library, download them on Audible, whatever you do. He's written 3 really important books. And one thing I forgot to mention about my experience while I was working at the National Center, actually before I trained as a court-appointed special advocate. And so the National Center was great about allowing me time off to complete my duties as a CASA. So in Utah, we do it. I know every state's different, but in Utah, a CASA is a volunteer that works with the child's guardian ad litem. And as part of my training, I was required to read one of Dr. Bruce Perry's book and one of his books. And I actually had the privilege of going to a conference in February where he presented, and it was incredible. So yes, fangirling all over Dr. Bruce Perry. And one thing he said in this conference, because the conference was about resilience, which is something we all need, especially children. And he said, resilience is all about our relationships, right? Children aren't born with resiliency. We as parents, we as caregivers, grandparents, loved ones of these children, those relationships keep our children resilient. So that kind of goes into that first bullet point of strong family relationships. It doesn't matter if you're a biological parent, an adoptive parent, a foster parent, a guardian, having one person in a child's life that is stable, that cares about them, that is consistent in their life, that is a role model, mitigates so much trauma. There's like the difference between a child who experiences trauma, secondary or otherwise, who thrives, and a child who doesn't, is that at least one strong person who cares about them and is a safe person. So another protective factor is the home environment, right? Sometimes these siblings come from homes where a parent was the perpetrator. So it's really important for their healing as secondary survivors to have very strong home environments. Another thing is safe and supportive schools. Does your child's school know that your child has a sibling who was a victim of a crime that might have some high needs? And is the school protective of that? Are they supportive of your family? Is this a safe place for your child to be? That's a huge protective factor. Positive peer connections, right? Friends. Remember a couple of slides ago when it said kids tend to withdraw from social things, social activities? Well, that's the exact opposite of what they need. They need those positive peer connections. Another protective factor is access to resources, healthcare, having financial assistance. Those are, having a doctor a pediatrician who can kind of watch out for some of these things for you, or if your family needs financial assistance through the state, these are some resources that are going to be helpful for your child. Healthy coping skills. Coping skills are my number one thing that I love to talk about as a therapist. We all have coping skills. Some of them are not very healthy. Me sitting on the couch watching reality TV, munching on Cheetos, probably not the most healthy coping skill. Making sure I get up every morning and go to the gym, that's a healthy coping skill. Not because I'm going to get buff or have the perfect body, but because exercise has shown that it reduces anxiety just as much as an anti-anxiety medication. That's huge, right? I'm not going to get, a model body doing 30 minutes on the elliptical 3 times a week, but my stress and my anxiety is really low. And that's essential for kids too. Getting out and playing. Maybe they participate in a sport. It doesn't even have to be a sport. You could just take them to the park where there's a jungle gym. That movement is really important for them. Other healthy coping skills, listening to music, creating art, that can be very helpful for these children. A lot of the kids that I work with, we do some artwork. Kids can process really well through that. One thing I do as a coping skill with these kids is we imagine, what does our safe place look like in our minds? When we close our eyes, what does that look like for me? When I am stressed, My safe, happy place in my mind is on the beach with a margarita and a good book and a umbrella to block out the sun. But what does this look like for these kids? And then I have them draw it. We have paint markers and I have little canvases and I let them draw it or color it. And then they have that visual that they can take home, that this is their happy place. So artwork is very, very important. And like I said, just one healthy, caring adult involved in their life. So again, Dr. Bruce Perry, these are his books. I don't know why it cut off the Born for Love book, but it's all about building empathy within your child. The book that I read when I was training as a CASA was The Boy Who Was Raised as a Dog. And that book is all about healing and resiliency and that one adult that can help you. So Dr. Bruce Perry is probably the #1 psychiatrist who has studied the impact of trauma on a child's brain and on their developing brain. And it's so fascinating, the neuroscience behind that. I tell my clients so that they can understand their own trauma, that we store trauma in our brainstem in the back of our brain, right? It's all the way back here. Our cognitive thinking is up here. It's right behind our foreheads. That's where we have language. That is where we are conscious, right? So when you have a trigger, let's say that child does maybe see the perpetrator or drive past the perpetrator's house, and this is the person that hurt their sibling, they might have a trigger that they don't even understand. It's way back here in the brainstem. Our brainstems control all of our automatic functioning, right? We don't have to think about our heart beating or our liver doing what livers do. I don't remember everything because I'm a social worker, not a nurse. So it's coming back here and it has to go all the way through our brain to the front of our brain to realize what is happening. And our brain stems can't tell time. So a lot of times when we're triggered, our brains are giving us warning signals because it believes we're back in that situation of the traumatic event. And young kids do not understand that it's not going to happen again, right? If they see the perpetrator most likely is not going to abuse their sibling again. So it's really important to kind of ground them in that moment and remind them, okay, your brain thinks this is happening again because your brain is thinking it right back here and has to come all the way up front to your conscious brain to realize this is not happening again. That was like the biggest thing that I learned from The Boy Who Was Raised as a Dog and from What Happened to You. This is probably his most popular book. It's his most recent book because he did it with Oprah. And it's a really good conversation between the two of them. Oprah talks about her own childhood trauma and actually a lot of her secondary trauma from witnessing some of the unhealthy adults in her life and their toxic behaviors. And he talks about what's happening in their brains. And I think the most important thing about this book is that when we see children who've experienced a lot of trauma and secondary trauma acting out, right, those angry outbursts, our first instinct is to say, what is wrong with you? When really should we be asking, what happened to you? So it's just a great book about resilience, which, like I said, I'm a big fan of Dr. Bruce Perry. It's incredible. And when I was at this conference, we were talking about resilience. So I might say something right now that might be controversial for some therapists. And this is what I'm going to say. Not all children who have experienced a trauma or a secondary trauma need to go to therapy. They don't need to be in a room with me doing cognitive behavioral therapy all the time. Sometimes it's court ordered. Sometimes their symptoms have progressed to the point that it's good to see a therapist. But what children need the most is those healthy connections with their peers and safe adults. That is where children do their healing, is in those relationships. feeling like they have the support of friends, feeling like they have safe adults who they can talk to, that community that surrounds them, something that the Sandys were talking about in their last presentation. And I apologize for not having a beautiful accent like they do. But I wrote down what Dr. Bruce Perry said in this resiliency conference because I thought it was so important. And it's that your history of connectedness. And what is connectedness? That is our connection to our communities, our families, our friends, our purposes. Your history of connectedness is a greater predictor of mental health and physical health outcomes than your history of adversity. And this whole conference was talking about children. So it's really important to remember not only your child who was a victim, but your child who is a secondary survivor. If you can keep them connected to the schools, to their friends, to your family, to the safe adults in your life, to their grandparents, aunts, uncles, whoever, this is going to mitigate so much secondary trauma from them. And it's going to be a huge, huge protective factor for them. Some of you may have read the book by Dr. Bessel van der Kolk called The Body Keeps the Score. And in it, Dr. van der Kolk talks about how our trauma, the stress events we experience, if we don't address those, it has a toll on our body. I can tell you, this might be anecdotally, all of my clients that have experienced a lot of trauma that they have never addressed for many reasons have health outcomes in their 40s and 50s that are pretty severe. MS, fibromyalgia, other like immuno diseases, right? And that was kind of proven. If you've ever heard about the ACEs test, that's adverse childhood experience. These kind of two doctors from Kaiser Permanente in California started doing surveys, and they had no training in trauma. They weren't psychiatrists. They were just regular like PCPs. And they started surveying their clients and seeing what adverse experiences that they experienced in childhood are now connected to health problems in later adulthood. And it was heart disease, it was risks of stroke, autoimmune diseases. And so it's just, if you haven't taken the ACEs test, you can just Google, ACEs score, and you can take the test. It's 10 questions. It's not expansive. It's a very limited look on it, but it describes like 10 scenarios that could be a traumatic event in your childhood that could affect your health later on. And if you have anything over a 4, they consider that a pretty traumatic childhood. And what we just talked about, you can reduce the impact of your child's ACE score because their sibling being a victim of a crime, is a traumatic event in a childhood. Those protective factors we talked about will undo a lot of that trauma for them. Address, so that later in their life, they're not experiencing these health problems. I'm sorry, watching my time. Like I said before, resilient children are made, they are not born. The most resilient people are the ones that have the strongest support systems. They may have been through a lot. A lot of us have been through a lot, but it's the ones who have thrived as children or adults because of those healthy relationships they've built with others. And Dr. Bruce Perry talks about how healthy stress can actually help a child build resilience. And healthy stress is something that's predictable, moderate, and controlled, right? Life is stressful. I'm a little stressed right now, right? Because I'm presenting at a conference and I want to do a good job. I don't want my former employees thinking it was a bad idea to ask me to do this. So that is some stress, right? So if you can create situations for your child where they experience stress that is predictable, it's moderate, it's not trauma, right? And it's controlled. These help build resilience for them. And that could be anything like being on a sports team, right? Three of my four kids have played lacrosse, right? And my daughter's team just went through the playoffs. And that was very stressful for the team as a whole. They're fifth and sixth graders. So, they're not like high school. So that was stressful for them. That is a moderate amount of stress, being, a playoff game, but it's in a controlled environment. It's predictable. We know what's going to happen, right? They're either going to win or they're going to lose, and it's going to be okay. And they did that in a safe environment with adults who can guide them. My husband's one of the coaches on our team. They've got another coach, and these are role models for these girls who are really, helping create these situations for them that where they can exercise a lot of resilience, right? And that, a lot of people have children in dance or piano lessons. I had piano lessons, those were stressful, but I didn't die, so I'm resilient. Sorry, I make jokes. But also encourage your child to engage in self-care. Self-care is never selfish. I would say self-care is creating a life for yourself that doesn't that serves you, right? Self-care is not just going and getting pedicures and taking baths. Self-care is paying your bills. It's watching out for yourself, taking a break when you're tired. It's all those things that make your life, creating your life to be a healthy life for yourself. And you got to encourage that for your kids. If they're tired, let them rest. If they need to eat something, they'll probably be hangry, right? And encourage a healthy snack. But self-care is not selfish. We have to care for ourselves before we can take care of anybody else. And that's true for your child as well. So how can parents help their children model those healthy coping skills? There's tons of them out there that are healthy. I like the arts. Those are things, listening to music. I'll probably leave my office today and maybe put on the Wicked soundtrack because I watched it yesterday. I went to the musical, so I've kind of got like a little Wicked thing going on here and nod to that. Right, having something to look forward to, something that it's enjoyable. Those are healthy coping skills. We don't often think of them as healthy coping skills, but they are. Learning mindfulness, that's a great thing that you can do to help your child. A lot of schools are teaching mindfulness, and what mindfulness is not thinking about the past, not thinking about the future. It's being still in this moment, right? This is a mindful moment for me because I'm completely in this moment with all of you. And I sometimes tell my clients, you don't have to have hours of mindfulness. It could just be, and you could encourage your children to do this, that when you eat breakfast in the morning, you don't have a screen, you don't have the TV on, you don't have your phone. You are just concentrating on your bowl of cereal. What does this cereal taste like? How does it feel in my mouth, right? That's a mindful moment because you are not distracted by anything. You are with yourself in that moment. Combat some negative thinking. Kids have we call them ants, automatic negative thoughts. Step on those ants for those kids. If they're having negative thoughts, show them evidence that what they're thinking is not true. Then I always am a loser. I never can make any friends, right? That's not true. You present to them evidence. They could say, I always make mistakes. And the evidence of that not being true could be everybody makes mistakes and you're just human and you don't always make mistakes. Sometimes you do a lot of good things. So combat that negative thinking for them. Good sleep hygiene, that's so important. Exercise, encourage them to talk about their feelings. I know as they get older, because I have two teenagers right now, they don't want to talk to me about their feelings until they really do. And it's usually when I want to go to bed. Make time for your kids to have fun, like having something to look forward to and having fun. That is so important. And it doesn't have to be expensive. Going to the park and running around and throwing a frisbee or playing on the swings, that's free and it's fun. I am in love with the library, and my local library has a million free activities that they have. And so, those are free and we can go do those together. Also create moments of quiet for them. That could be quiet with a book, turning off the TVs, taking away their screens. just having a moment of quiet. Get outside, and that's one of the grounding skills I teach clients is you got to put your feet in the dirt sometimes, ground yourself to the earth. And then also encouraging art and journaling, like I talked about before, like artwork is very important. That's how children express themselves, and maybe some older kids in their teens, encouraging them to journal, to write about their feelings. They never have to look at what they've written again, but just the act of getting it out of them can be really important. So here are some resources, and I'm sorry if I'm if I am running out of time here. I don't know if you want to take a screenshot of this. When I go to virtual conferences, I always have my phone up there. Like, I got a screenshot, I got to take a picture of this. In my community, we have a wonderful organization called the Center for Grieving Children. And that is a place for children who can go have had a loss, whether that's the loss of a sibling, loss of a parent, anybody important in their life. Does your community have an organization like that? You might not know. It's great resources. The Letha Collective, I did this just the other day. I thought it was great. They have a free downloadable journal for siblings, for siblings who have a sibling who has a sibling who's disabled. It's a great journal. It's guided journal, talks it all through. I'm gonna print out 100 of them and give them to my clients. The Trauma Research Foundation, that's Bessel van der Kolk's foundation. They have lots of free trainings on their website that if you want to understand more about trauma and secondary trauma, that's a great place. Families Rising, they have a great education and resource library. This is a book that was recommended to me by another therapist called The Normal One. This might be more for you parents, but The Normal One, Life with a Difficult or Damaged Sibling. So this is about children who might have a sibling with a disability. The Sibling Support Project is a great organization. And then Psychology Today, that has a search engine for local therapists. I love it. My profile's on there. That's how I get a lot of referrals. You just go in the directory, you put your zip code, and you can do filters of, this is my insurance. I want a child therapist. I want one who works in this specialty, and it will kind of show you who's in your area. It can also, if you want, have people who may not be in your area, but do virtual sessions. However, I would say if you are going to put your child in therapy, it needs to be in person. Doing virtual therapy with children is very difficult. Rachel, I'm going to keep this slide up a little longer.
Perfect. Yeah.
So people can look at it, but I think the next slide is just, do you have any questions? Does anybody have any questions? I talked forever and it's over now, but no questions. All right.
All right. Well, thank you so much for presenting to us. You
And
gave us a lot of yeah.
I've just put my email right there. I'm at Wachoni Counseling Service in Layton, Utah. So if anybody, didn't have questions during this presentation, but thought of something afterward, they're more than welcome to ask questions.
Well, thank you so much. That was so much great information, and we were so glad to have you.
Yeah, thank you for asking.